the madam is the Sahel Director, West and Central Africa, and she's a Malian vision and champion for the rights of women and girls, and with a demonstration of passion for human rights and social justice. She has 20 years of experience holding leadership roles with WaterAid, Oxfam, the Canadian International Development Agency, and most recently, Plan International. So, Madam Fatuma Haidara, kindly give us your opening remarks and in the context, and give us opening remarks on international advocacy on SRH and ending child marriage in Africa in the context of global pandemic and Plan International Advocacy Strategy of SRH and ending child marriage. Dr. Fatuma.
Thank you very much. Good morning, good afternoon again. Dear participants, I would like to start with one main message based on my own experience and what I have seen in countries across our continent. There can be no valid or effective responses to ending child marriages in Africa without respect to sexual and reproductive health and rights of young women and girls. We know that the sexual and reproductive health and rights of girls and young women are not being sufficiently addressed, both as a result of previous social norm and accessibility challenges as the COVID-19 context. Before COVID-19, 6 out of 10 of the countries with the highest prevalence of child marriage in the world are in West and Central Africa. The overarching goal of the webinar is to help bring the epicenter of the continental and global policy arena the remarkable roles that sexual, reproductive, and health and right advocate from community as well as civil society organizations are playing in the ongoing effort to end child marriages in the context of COVID-19. You will discuss your role in ending child marriages in local communities, sub-regional and regional fora across Africa in the context of COVID-19. I would like to welcome the EU Ending Child Marriage Campaign, Ms. Nina Tundu, the Global She Decide Movement Chairperson, Ms. Tikala Itaye, Girls Not Bride, and traditional leaders, including Chieftainess Chikumbu, young women advocates, community organizers, local governments representatives, and activists at global level. Dear participants, ladies and gentlemen, the COVID-19 pandemic is creating a huge global health crisis with negative ramifications for social, political. According to 2020 estimates, Africa counts about 309 million girls under 18, majority of whom are schools-going children, hence currently staying at home in the midst of lockdowns across the continent. Community coping mechanisms deepen gender inequalities and have given rise to reported increases in child marriages and gender-based violence. UNFPA predicted millions more cases of violence, child marriage, female genital mutilation, and unwanted pregnancy is expected due to the COVID-19 pandemic. Rise on unwanted teenage pregnancy during the COVID-19 lockdown have been documented in various African countries. Plan International report also shows that the well-being of thousands of girls could be at risk as a result of unwanted teen pregnancies amid the global pandemic. During crises, the rights of girls and young women tend not to be prioritized in the response and commitment plans of government, humanitarian actors, and donors. In fragile contexts, families may be forced to consider child marriages as a strategy to cope with economic hardship or to respond to social and cultural pressure. The World Health Organization in 2020, in a guidance, COVID-19 and violence against women, what the health sector system can do, has emphasized the role of health systems in ensuring that services for women who have experienced violence remain accessible during the COVID outbreak, although COVID-19 has placed an immense burden on the health system and health workers. Dear participants, the struggle is long and difficult. For many adolescent girls and young women in Africa, this right remains unfulfilled, and the restriction imposed as a result of COVID-19 pandemic exacerbate the existing fragile access to SRHR. Despite the mixed results, I would like to stop for a moment and recognize the actions at the normative and operational level are being implemented at all levels to fight against child marriage and teenage pregnancies. At global level, SRHR is clearly stated in CEDAW, which devotes major attention to reproductive rights. This has been reaffirmed in ICPD as well as in Beijing, which also states women's right to decide freely and responsibly on matters related to their sexuality. The SDGs goals and targets encompass many key aspects of SRHR, including access to sexual and reproductive health services, comprehensive sexuality education, and the ability to make decisions about one's health. At regional level, the EU has a strong and comprehensive normative and institutional framework on gender equality and women and girls' rights, one that continues to evolve and become stronger. The Solemn Declaration on Gender Equality in Africa, the Maputo Protocol, and the EU Gender Strategy and Initiative, such as the EU ECM campaign, the Salima Initiative, and the recent Spotlight Initiative are key components of this normative framework. Ladies and gentlemen, this is time for solidarity and joint action. The webinar brings together all of us to share the context, good practices and recommendations as SRHR advocate on ways to contribute towards our goal of ending child marriages in our continent during the COVID-19 pandemic and beyond. This is also the platform for us to network, strengthen our partnership, and share our learning on how to ensure that the SRHR right of young women and girls of Africa and the youth in general can be realized. I would like to wish you good luck in your deliberations. I am confident that you will produce good lessons and recommendations, and I look forward to seeing the outcomes of this important event and how we are translating them into results for the people we serve. Thank you for your attention.
Thank you so much, Daktari. In Africa, in East Africa, we say Daktari, meaning doctor. Thank you so much for very inspiring words and showing the interrelationship between SRH and child marriage. So next on my list is Tikala Itai. Tikala is a lawyer by profession and passionate about social justice. She leads her own youth-led NGO in Malawi and called Her Liberty, and is the former president of African Youth and Adolescent Network that works with youth networks in East and Southern Africa. She's a former board member of the Global Partnership on Maternal, Newborn, and Child Health, and is currently chairing a global movement on women and girls' rights called She Decides. Tikala Takurandirani, thank you so much for joining us. So we just want you to give us your keynote on focusing. Sorry, I'm parenting. Sorry about that. The keynote address to focus on how to engage African youth leaders in SRH and ending child marriage. Someone needs to mute. Someone needs to mute. Someone needs to mute. Thank you very much, Zacharias. Thank you.
Should I take it away?
Yeah, yes, go away. Katakura Ndirani, thank you very much.
Ziko Mogwambili, thank you so much for the warm welcome and really excited to be part of this important discussion. Distinguished participants of the webinar today, I have a dream. I have a dream that one day we will no longer be talking about how to address child marriage or how to end child marriage, but how we eliminated child marriages. I have a dream that one day every woman and every girl will truly be able to decide about her life, her body, her future without a question and without the need of continuous advocacy to convince political leaders, community gatekeepers, and traditional leaders on the needs of every adolescent girl and young woman. But the reality of these dreams all depends on one word, which has been choice, choices. In May 2014, we know that the African Union member states made the choice to launch a 2-year campaign towards ending child marriage. They gave youth advocates like myself and many others a voice to stand up and to speak out on the harmful impact of child marriages. As the former president of the African Youth and Adolescent Network, where we were coordinating youth-led organization in Eastern Southern Africa, I had seen and felt the desperation of youth leaders and youth advocates leading their own youth-led organizations, how they were advocating political leaders to understand the harmful impact it had on adolescent girls, as well as on our society and our economy as a whole, on the harmful impact of child marriages. But with all this work we were doing, I think one big takeaway was the choices development partners made to work with youth leaders and youth-led organizations to lead the change that they wanted to see. Just recognizing institutions like Plan International, Girls Not Brides, the Southern African AIDS Trust, which is also known as the Southern African Reproductive Health Rights Africa Trust, recognizing the Global Partnership of Maternal, Newborn, and Child Health, UNFPA, and many others that took on that commitment, that choice to work with youth-led organizations and to support them to be able to present the needs that were affected by adolescent girls, but at the same time to be able to work in their respective communities to advocate for change within their communities, as well as hold their leaders accountable. AFRIAN had been a youth network where had the opportunity to engage with different decision makers at national, regional, and international level. It was a network and is still a network that is giving young people an opportunity to engage in intergenerational dialogue with the political leaders, with decision makers, to ensure that the issues that are affected by adolescent girls are brought to the table. One thing that we need to understand is that it is that intentional choice. For it to be a best practice, the way I'm sharing it, it has to be an intentional choice among development partners, among government ministries, and all other partners to intentionally work with youth leaders to address this issue. The important thing about working with youth leaders is that youth, especially in our African soil, make up the majority population, meaning that young people and young leaders carry the power to really enforce collective action and also demand change among political leaders. So one key thing is to recognizing the power of numbers that young people bring when it comes to enforcing change. The next thing is there needs to be an intentional choice among development partners and government ministries in the way we are coordinating and leading and implementing change around ending child marriages. We have seen that years of working around addressing child marriages or early and intended pregnancies, that we have a huge fragmented movement. You have this NGO working here and you have that NGO working here, and everyone's doing different things at different times, which is causing such fragmented efforts in our effort to address ending child marriage. And there's a need for us to really coordinate our efforts. And within that coordination, youth leaders need to be brought to the table. Now, speaking on bringing youth leaders to the table, one key thing is meaningful youth engagement of youth leaders. I have seen in 8 years of my experience as being a youth advocate of a lot of youth leaders being brought to the table just for mere consultation on what works or what should be done in a certain program, or just training around youth advocates. But one thing is, you cannot drive a car to its destination if it's not given the fuel it needs. And youth leaders need the investment to build their capacity, not only as an individual to be strong advocates, but to also build their institutional capacity, because the majority of them lead their own youth initiatives, their own youth projects, as well as leading their own youth-led organizations. So it is very important to make long-term decisions and choices to work with these youth leaders as implementing partners, where they do receive the institutional capacity and support and resources to run long-term projects and interventions that are addressing child marriage. We need to recognize that most of the youth leaders and the youth advocates come from these communities where we have seen high rise of child marriage or violence against women or issues of early and unintended pregnancies within these households, within these families, within these communities where majority of these youth leaders come from. So best believe that they would know the solutions that will address the needs in their communities as well. And lastly, to just really mention that with organizations that I work with, for example, Her Liberty, we have really seen the tremendous impact of working as an implementing partner, just sharing that, Her Liberty itself had an opportunity to be an implementing partner, working with international institutions like UNESCO and UNAIDS, as well as government ministries in Malawi, where with just 3 months, with just the support, the resources we were provided, the training we were provided, the institutional capacity we provided, with just that support, within 3 months, we were able to reach 4,000 adolescents in hard to reach locations, which I must say, many had no clue that child marriage was illegal. So we really need to know that youth leaders are such an asset in this space because they go to the communities where no one else is reaching. And another thing, we have programs led by international organizations like the Women Deliver Young Leaders program, as well as the movement that I'm part of and also co-leading is the Global She Decides movement that has made that commitment to support youth leaders to lead and run change the way they envision it. And this has entailed supporting young leaders with even seed grants. And it has been so overwhelming to see the impact young leaders are making with just that seed grant. However, one seed is not enough for us to get the sustained impact we need around addressing child marriage. We need a bag of seeds and long-term interventions to address child marriages. I think we have seen so much data that has showed that we're dealing with issues around changing mindsets and changing cultural and traditional customs that have taken 20 or more over years of practice. But yet many of the interventions and the campaigns we run would be 3 months, 12 months, or 1 year. But we need to make sure that if we are truly going to address child marriages, we need to make long-term investments in addressing critical issues around social customs and changing mindsets that have been practiced for years. So long-term intervention with coordination with young leaders on the ground. And in conclusion, is to say that a lot of institutions and organizations and development partners out there have been working with youth leaders as youth advocates and youth leaders, but to also recognize that youth leaders carry the expertise that a lot of these institutions can capitalize on. I mean, for example, I myself, I'm a lawyer by profession, and a lot of work that I've brought in this space has not merely been a youth advocate in the space, but one person who carries expertise in supporting on how do we enforce laws that reach adolescent girls, especially in rural and hard to reach locations. I have met and worked with many young leaders who represent sectors like, who've been experts in just being community leaders or community engagers or experts in just software design, social workers, and all this expertise around. But most importantly, the victims of child marriage themselves have been the key to actually designing programs that are very holistic, because we all know that we can't look at this issue on just a one-sided way, but being able to design a holistic program that gives adolescent girls themselves the choice on how we actually address issues around ending child marriage, because they've seen and felt their experiences around child marriage. So the key thing is that human-centered approach around that adolescent girls will ensure that we truly address issues around child marriage. The partnership with youth leaders and different youth-led organizations will ensure that we are reaching hard to reach locations, but at the same time also making impact that will go beyond just the campaign, but literally allowing young people to take ownership and drive the change that they need. Thank you.
Zikomo, thank you very much, Tikala. Those are very good. I love the analogy of the vehicle. Like a vehicle cannot move unless there are people in it. So our next speaker is someone who is working at the AU End Child Marriage campaign. Twambo Rona Mumba. I know the first phase of Ending Child Marriage campaign has just finished, and you're coming to the next phase. Twambo, so my question is, how does universal access to SRH for young women and girls contribute towards achieving the goals of the second phase of the African Union End Child Marriage campaign? Twambo?
Thank you, Jennifer, for your question. It's a pleasure to be joining you.
Switch on your camera, please.
Can you hear me?
Yes, we can hear you. Can you switch on your camera, please?
Hello?
Yes, go ahead. Thank you. Okay. Twambo, can you hear us? Twambo? Twambo, can you hear? Just switch off your camera because you have slow connection so that we can hear you. Just switch off your camera, it's fine.
It's a pleasure to be here participating in this webinar. I'm here in the day to end child marriage. I can hear you. Can you hear me?
Okay, just speak. We see if it's better. Twambo? Twambo?
Hello?
Yes, go ahead now. You're better.
I can hear you. Can you hear me?
Yes, we can hear
Jennifer,
you.
are you able to hear me?
Go ahead. Yes, we are. Go ahead.
Hello?
Yes, Twambo, go ahead.
Okay,
please.
so I think I'm going to stick to audio.
Yeah.
Apologies, my connection is very Hello?
I think we've lost Twambo. So, but next, as we try to get hold of her, so we have two young advocates, Miss Judith Chimwaza and Miss Melania Capolo. Are you there with us? Judith and Melania?
Yes.
Oh, Muko? Okay, asante. So, swali langu ni, I'll try to translate this in as good Swahili as possible. Swali langu ni SRH services zinapatikana wakati huu kwa vijiji zenyu ama kwa katika nchi yenyu, especially saizi kwa sababu ya COVID-19. Watu wanaweza, wasichana ama vijana wachanga wanaweza kaenda kupata hizi services. Services Kiswahili imepotea. Services za SRH. Judith na Melania. Tuanze na Judith.
Okay. Accessing to SRH services due to COVID-19 in our community because of some reasons. Some of this is long distances. Many youth travel a long distance to access sexual reproductive health services. End results, only few get the services. And besides that is access to information. The information concerning about sexual reproductive health services are delivered to schools and youth centers. So due to COVID-19, most youth schools and youth centers have been closed. So the information concerning about sexual reproductive health services are not being delivered to the youth. And it's not all the youth who have access to listen to a radio or have a smartphone to download or Google any messages concerning about sexual reproductive health services. And to add on this, community perceptions and attitudes towards young people, especially girls in community. Sexual reproductive health services, the married ones. So the end results, they found that many girls are not going to the health facilities to take the services, to fear or maybe shy because they'll be called many names like prostitutes. So for this, there's a need of a resolve to resolve these problems. There will be a provision of mobile sexual reproductive facilities or services to those who live in remotest areas. So they should be delivered the services at a village level. Yeah, and also more awareness meetings, especially saying about the sexual reproductive health services, and the traditional leaders are the ones who work on the ground. So there will be a more awareness meeting concerning about the rights of the girls and boys. They have a right to get sexual reproductive health services. Yeah, thank you very much.
Thank you very much. And Judith, that was Judith, right? Was that Judith?
Judith is, hello?
Yes.
Yeah. Judith
Yes.
is this one here.
Okay. Judith, then the question: what conditions of what is the condition of access to SRH services in your community, especially now for especially now for COVID-19? And I can see because you're on the move, you can answer both questions together. What do you think is the urgent? What is the urgent need for young women and girls in your community?
Could you just, the question is not clear. Could you just give me that again?
Okay, the question is, Judith, what is the condition of access to SRH services in your community or country? is the urgent need of young women and girls in your community with regard to health and services?
Okay, I think someone needs to mute their microphone. We can. Okay.
Alexisa, mute yourself. Thank you.
Somebody must mute the microphone. Yes, so greetings to everyone. My name is Judith Mwila, and I am part of the executive committee of the Zambian Network on Ending Child Marriages, and operating from this as a secretariat, and also
Judith.
I am founder.
Sorry,
Yes.
Judith, you are the wrong Judith. I'm looking for the Judith who is for the young person. So I think it was the, yes, that was what your question is, for the young person, Judith.
Okay, I'll mute my microphone and wait for my chance.
Okay, thank you so much. So Judith Chimwanza, that's what I mean. Sorry, we have.
Hi.
Hi, you've already answered your question. So Melania Capolo, I think Melania from. Yes, your question. Umeshika swali?
Ndio.
Okay.
Katika kipindi cha corona sisi tuliweza kupata huduma katika nchi yetu au katika mkoa wetu, kwa sababu corona yenyewe ilikuwa imekuja kuharibu vitu vingi sana ikiwemo uchumi wetu. Kwa hiyo huduma hizi zilikuwa zinapatikana kwa hafifu sana. Tunashukuru katika mashirika, kuna baadhi ya mashirika yalikuwa yakitupatia huduma kwa ajili ya kuwezesha wasichana kujistiri. Tunashukuru sana katika shirika la Plan International, ilituwezesha kutupatia baadhi ya vifaa ambazo ni pads zilikuwa zikisaidia watoto wa kike katika kipindi cha corona. Pia tunamshukuru Mungu katika kipindi hicho ambacho tumeendelea nacho, kwa corona imekuwa ikipungua sana, kwa hiyo watu wanapata huduma, pia tunapatia elimu. Tunakutana katika klabu zetu kwa ajili ya kuendelea kuhamasisha wale ambao walikuwa wakipata shida katika kipindi cha corona, ama wale ambao walikuwa hawajui nini maana ya kujitunza wao wenyewe ili waepukane na mimba za utotoni. Hello?
Yes. Endelea.
Okay. What she's trying to say here is that in our context, or I can say in our country during the corona pandemic, we did experience a little bit a challenge when we because people had some obstacles in accessing important services, especially when our economy was a bit had a bit invited with the challenge of that disease. So young people, the adolescents, had no capacity to access the sanitary pads as among one of the sexual reproductive service. So thanks to the institutions like Plan International, who managed to provide the young adolescents the sanitary pads which they could not access at that particular time. But coming to this period, and of course during that period, it was a bit a challenge for the young adolescents to share the knowledge, to give each other's advices, and also community leaders to make people aware, or to make the young adolescents understand the effects of the effects that goes along with having more the knowledge about sexual reproductive health education. But at this particular point, when our country a bit went in a good situation where the lockdown was over and things are going smoothly, so spread the knowledge and the services about the importances of children being carefully and understanding what the sexual reproductive health requirements and needs are. So it was at this particular moment
children at least access the knowledge, how to be careful, how to abstain from sex, how to the effects of engaging themselves in activities or things that can lead them to contacting maybe the diseases that goes along with it, with having more the knowledge about sexually reproductive health. That's what she has said. Hello?
Asante. Umemaliza, unataka kuendelea? Endelea.
Nimeshamaliza.
Ushamaliza? Okay, asante sana.
Endelea.
Unataka kuendelea usalie nyingine?
No, she's done.
Oh, she's done. Okay. So Twambo, are you back? You can give us your statement very quickly. Twambo, are you back? Twambo? Oh.
Yes, I'm back. And hello.
Yeah, do it very quickly when you are still on.
I hope everybody can get me.
Yes, we can.
Anyway, before I proceed to answering my question, I'd like to give a brief introduction on the campaign to end child marriage, just in case many may not know anything about it. So the AU campaign to end child marriage was launched continentally in 2014 with the aim to accelerate actions to end child marriage in Africa through enhancing continental awareness on the drivers and implications of child marriage, mobilizing key stakeholders, and catalyzing policy, programmatic, and advocacy actions. During the first phase, which was from 2014 to 2018, 28 countries launched national campaigns as part of the AU's continental effort. But despite the commendable efforts and commitments, the issue of child marriage still poses a threat to millions of girls on the continent and around the world, and it greatly impedes the realization of Agenda 2063. So therefore, in 2019, it was deemed necessary to extend the campaign for another additional period, which is 2019 to 2023. Following the decision to extend the campaign, a strategic plan was developed for the next 5 years, the next phase of the campaign, which is for 5 years, 2019 to 2023, drawing from lessons learned from the previous phase of the campaign. This strategic plan intends to put in place a comprehensive, coordinated, and mutually reinforcing set of activities to galvanize and accelerate actions by member states, partners, and communities to end child marriage. The strategy, which builds upon the initial one, creates a platform and acts as a guidance tool for addressing issues that affect women and girls and are in one way or another linked to child marriage and sexual reproductive health and rights. So moving on to the question, one cannot overlook the role that inclusive access to adequate, comprehensive SRHR information and services plays in tackling child marriage and its consequences. Ensuring SRHR information and services is undeniably a necessity, not only to protecting girls and young women, but to also helping them contribute to the realization of their potential and combating complications linked to child marriage. Once a child is married at an early age, girls are often forced to serve a reproductive role, and this denies them access to information or family planning services, which can otherwise help them delay or space pregnancies until they're ready, both physically and mentally. Many adolescents end up having a limited understanding of sexual intercourse, limited access and availability of reproductive health information and services. Particularly, those are designed to be friendly with their age group, meaning youth-friendly for both unmarried and married adolescents. It's also important to highlight that increasing access to SRHR education to boys will also help counter harmful social norms and practices, increase understanding of key issues around rights and consent, and also equip boys to protect young women and girls, and also themselves against STIs and HIV. The campaign to end child marriage moving forward aims to create more advocacy platforms where key stakeholders, including women and girls, engage and discuss on pertinent issues such as HR and harmful traditional practice. Or Summit on Ending Child Marriage, which is organized every 2 years by the AU Campaign to End Child Marriage, is one of these platforms. In ending, I'd like to say that the universal access to SRHR for young women and girls ensures that the objectives of the campaign strategy and the AU strategic document on Africa's agenda for children are addressed and achieved. Supporting SRHR-related policy advocacy and actions, removing barriers and bottlenecks to law enforcement that relates to SRH tools such as this webinar and the Girls Summit, the AU campaign to move forward with the accelerate and end child marriage in Africa. Thank you.
Thank you so much. Sorry. Thank you so much, Twambo. I'm sorry because of the internet, you know, but you understand during this time, you just have to adapt. So the next question goes to Dogbat. Dogbat, you will. This question is on what works to change harmful cultural practices. We've seen some amazing examples from Malawi with Chief Chikumbu, and so what works in terms of ending? What are the best practices in ending harmful practices that limit girls and young women autonomy and choices when it comes to sexual reproductive health and rights in your country and community? Dogbat?
For me, I think it's more around addressing the issues to do with the social norms. I'm talking, currently I'm sitting in Nairobi, but originally I'm from Zimbabwe. But it has been around, influencing issues to do with addressing the social and cultural norms, but also, ensuring that youth or adolescent friendly information is actually well packaged, that is actually friendly to this specific group. And the services that are also even provided are also provided by youth-centric service providers. Because I think it's one thing to provide access to sexual reproductive health and rights, but it's also another thing to ensure that these facilities are also closer to these youths, and these facilities or the service providers are also accessible. What we've noted, like in Zimbabwe, for example, during the COVID-19 pandemic, which is still ongoing, is that a lot of these youths used to get most of this information mostly from gatekeepers within the schools, or those multi-sectoral partners that work directly with the schools. But considering they are currently out of school, we have seen an increase in terms of, abuse cases within even the household. And some of these even abuses are even done by closer perpetrators. We have started to witness a lot of, unwanted early pregnancies. And I think as we discussed within this forum, we also need to think of other innovative ways that are going to be done in terms of ensuring that even those young girls who actually fall pregnant during this era would have access to ongoing education. And if you look at most of these African laws, including in Zimbabwe, I know recently they just won a legal case to ensure that even those who those girls who actually are pregnant can still continue to access education. But it also becomes a barrier if we are not innovative and creative around ensuring that we also keep the girls in school.
Thank you so much, Dogbat. My next question goes to Judith, Judith Mwila. Judith Mwila, are you with us? Judith Mwila, are you with us? Okay. So
yes, I am here. I am here with you.
Hi, Judith. So the question is on child marriage in Africa during COVID-19 situation. Did you get a question?
Yes, I heard the question, and I would just like to ask if I can have my camera off because it's compromising my access to internet.
Yes, no worries.
I'm sure.
No worries.
Thank you. Yeah, so as I had tried to introduce myself, our organization, which I founded, is called. So coming to your question, the family system is the first contact to children, to adolescents, and to the family members. So as an organization and working with the Zambian Network on Ending Child Marriages, we have seen that the issue of adolescent sexual reproductive health is a critical component on one for ending child marriages, as well as having a reduction in teenage pregnancies. Now, during the COVID situation, what has happened is that everybody in the family is staying together at the same time. And so one strategy that has worked, which can work even elsewhere and all the time, is the fact that family members need to be present in the lives of adolescents. And here, first of all, we look at the parents. How are they involved in giving sexual reproductive health education to their children who cannot now, during the COVID lockdown, they cannot take a trip to go to the safe spaces in the health centers or even the school SRH clubs. They cannot effectively relate with their peers where they can probably share information. And so one of the critical issues is to ensure that adolescents are still able to access information while they are at home in the family environment. And one of the ways to do that is to the parents to start having discussions with their children on SRH. And this in Africa, Zambia is very, very African. And so the tradition is that parents cannot talk to their children about sexual reproductive health issues. So we are encouraging, as an organization, we've got currently running a campaign since 2017, which is called the DOS. These are the elderly women who are involved with the teaching of girls when they at the rite of passage, when the girls have become of age. They are the first contact to the girls. So we are working with them, and we have developed an adolescent sexual reproductive health reference manual, which I'll be very happy to share, just because it has really worked in 2 districts so far. We have been able to have a drastic reduction in Zambia. Most of our traditions are that when a girl becomes of age, she must know things about marriage. And becoming of age, they are respected in the community. And so we engage them, and we've got this training manual, which has now focused on changing the message at the right of at the entry of rights for adolescents. When they become of age, what are they going to talk to the girls about? What are the messages that they are sharing with them? And during COVID, because there is a lockdown, the girls are not also going to those women in a groups, because traditionally they'll be in a group for about a month, and all the girls will be locked up in a certain house, and they're teaching. We have said that they use the information which we have restructured and repackaged to include sexual reproductive health and choices, so the girls can also have their choices about prevention of pregnancy and the rights of choices as well, where the parents do not allow children to access condoms or any information. I can take more questions. I could just go on and on, but I think that most of all, ending child marriage has also got a deep root in what the girls are being taught at a certain age. And that point is the entry of passage. When the girls become of age, what are they being taught? It's a great issue that actually propels a lot of gender-based violence, because right from that point, the girls believe that they are only made to be married wives. So in their minds, what are they learning, and what are they perceiving themselves in a few years' time? Thank you very much. I'm sure my time is up.
Yes, it is up. Thank you so much, Judith. The same question goes to Mwanaidi Mundumbi. So the question is, how do we ensure provision of SRH in Africa during COVID-19? Umeshika ni
ongea na Kiswahili.
Okay, swali ni vitu gani zinaweza kafanywa kuchana wasichana wapate hizi services za ESA kwa sababu ya COVID-19? Tunaweza kafanya ni mambo gani inaweza kafanywa ndio watoto wapate hii services za SRH? Mwanaidi, umeshika? Mwanaidi, upo? Okay.
Nipo. Ni watoto kwamba tuwafanye ili tu kwamba wasipate matatizo. Kwanza ni kuwaelekeza kwamba wajilinde ili wasipate mimba. Athari zake zitatokea kwamba wao watakuwa miili yao itakuwa imeathirika kiafya. Kingine ni kwamba watoto ili wasiwe na matamanio, ili tuweke sheria zinazotakiwa na elimu ya kuhamasishana wakina mama.
Hello?
Yes, you're going to translate it?
Oh, you want to... Okay, she's saying that we need so much education, especially to these young people, so that they can understand the impacts of engaging themselves in sexual affairs when in the absence of sexual reproductive health education. So there's so much effort needed for them to understand that they may put themselves at risk, especially finding themselves in maybe getting health problems due to having been exposed to sexual affairs at very early stage. So that is the point she's trying to make. Or who are the main coaches of these young girls, they need to invest their efforts much in educating these young adolescents so that they can escape or they can get rid of things that may take them to be victims of yes. Thank you.
Agnes Pika is there. Agnes, are you there? Agnes Pika, you there?
Hi, Jenny. I think she's still trying to join.
Okay.
But yeah, so we can.
Okay. So the next question goes to Selamawit Tesefaya from Plan International AU Liaison Office in New York. UN, sorry, not AU. I'm so used to AU. UN. UN Liaison Office in New York. The question is, what best practices are there at the global level on SRH and end child marriage advocacy? What can SRH advocates in Africa learn from the global level SRH and...
You can hear me well, right? Okay, I'll just proceed assuming that you can all hear me to sort of like give us context on like what we're talking about. And most of the issues have already been raised, so I will not go into that, and I'll make my intervention as short as possible in the interest of time. So in terms of UN advocacy in New York, where I'm based, our advocacy focuses on international standard setting, where we try to influence different UN bodies, including the Commission on the Status, try to have strong language on girls' rights, including SRHR, child and early forced marriage, and also FGM, so that we are setting new international standards that are that have strong language for girls. And these international standards can be developed by a UN body or process in three main ways. And the first one is the outcome documents. And these are negotiated by UN member states and agreed upon, and such as the agreed conclusions for the CSW, for instance, or resolutions in the UNGA committees. The second one is compiled by experts, which include general comments, concluding observations, and so on by treaty bodies. And this is usually done in the Geneva space. And the last one is official language out of UN agencies such as UN Women, UNFPA, UNICEF, and so on. So generally, outcome documents have particularly high clout because they are negotiated and agreed upon by member states. That is, if a UN member state makes a commitment agreed upon in a resolution, then they are responsible for upholding those commitments. And these outcome documents are often negotiated through official negotiations with representation from member states, and they are usually a long process that have various iterations of outcome documents. So that's sort of like what we mean in terms of like our engagements in influencing these outcome documents at the UN, and hence the UN advocacy efforts. So what do we mean by SRHR advocacy at the UN? So most of you have touched upon like what we mean by SRHR, and especially the link with child and early forced marriage and FGM and other harmful practices. So I will not go into like what we mean by SRHR, but what we do in terms of like the SRHR advocacy. And as you have already sort of like also touched upon, these services are directly linked to the practices of child and early forced marriage and also FGM. So in our SRHR advocacy, we mainly utilize, general agreed upon principles such as the SDGs, SDG 3 on health, SDG 5 on gender equality and empowerment for women and girls, the ICPD, which was mentioned at the beginning of this panel, and also other human rights instruments that are relevant for influencing the documents. So what we mean by in terms of like our advocacy is like we engage with member state representatives through bilateral meetings, joint briefings, written comments, and also submission of suggested language to push for an outcome that is strong on girls' rights. So the question that was sort of like directed to me was, how can we sort of like use this global SRHR advocacy at the national level? So I will just focus on that. And like I've said before, resolutions are not binding or enforceable, but rather normative standards. But SRHR advances in this UN bodies are very significant and can actually be translated into concrete outputs in advancing SRHR through different channels, like for instance, influencing national legislation, which is one of the ways that can be used at the national level. That is like, for instance, if a country commits to a more progressive standard at the global level, then civil society actors such as ourselves and advocates can push for reforming national laws based on that commitment. It can also be used for calling for further reporting, which means like civil society can push for implementation, strengthened implementation, and so on. And in some cases, also giving guidance to national courts. For instance, if the national law is very ambiguous, then some national courts can actually resort to international definitions just to clarify a certain practice or process. So all in all, civil society plays a very important role in ensuring that their governments are held accountable to their global commitments. And there's also a need to compare countries' commitments at the international level and national laws and policies. For us at Plan International, for instance, by working with our various country and regional offices, we ensure that the national and global commitments are aligned. It can also be noted that some mission representatives who are engaging on behalf of their governments at the global level may not always present the national position and may push for more conservative agenda. So that's when civil society comes in and makes sure that, there is joint advocacy at both levels. So that's sort of like how we can use the global level engagement at the national level and vice versa. So in terms of best practices, like for instance, for our purposes, the child and early forced resolutions that are presented both at the General Assembly in New York and in the Human Rights Council in Geneva have been one of our best practices in this regard, where we align our focus as well as the language we're trying to influence on both sides. For example, in the 2018 UNGA resolution on child and early forced marriage, the thematic focus was on rights of already married girls, which was then picked up in Geneva for the 2019 Human Rights Council resolution. So in this resolution, because of like our joint advocacy efforts, we were able to achieve strong language on both sides that called for agency of girls, various services for married girls, and even the recognition of marital rape within the context of child and early forced marriage for the first time in an UNGA resolution. So, and like I've said before, and this work was highly informed by country and regional offices, which developed like various research data and various advocacy efforts, which we built on to sort of like show how we can be able to use that evidence at the global level. So again, showing the complementarity between those two levels. So I think in the interest of time, I'll just stop here and happy to answer any questions that can be presented at the end. Thank you.
Thank you very, very much. I love the way you have connected the two levels, the global and the African context. It's amazing that we sorry, gosh, sorry. So thank you so much for that, Salem. So our next person is Agnes in. Has she managed to join in? Not yet. Agnes? Not yet.
Not yet, but she's trying.
Okay. Perirai, Perirai from Gasnot. Perirai, are you with us? Or you? I think I saw you at some point. Oh yeah, you're there.
Yes, I'm here. I've been having some connection troubles, but I've managed to log in just in time.
Yeah. Hi. So I know Girls Not Bride have been doing an amazing job on ending child marriage, but what works in engaging women and girls in leadership roles on SRH advocacy to end child marriage and unwanted pregnancies? And as you're answering that, what works and what are the challenges in advocating? What are some of the what is working, and what are these challenges on engaging leadership, and girls?
Hi, sorry, my cousin was just, yes. So I think I will start with what we've seen has been working. So I would like to focus on two things. The first is I think we are always talking about partnerships, but I think it's about having partnerships which are one, effective, partnerships which are communicative, and partnerships which disallow for duplication of work. And this is where we found being a part of the Girls Not Brides network to be very, very helpful in our work as Rosaria Memorial Trust. And I think also one thing which has helped, especially during this pandemic, is also allowing for, through working with other organizations and working together, especially on a grassroots level, on a community level, it ensures that all our efforts can be streamlined and effective. Then the second thing I would like to touch on is also the notion of safe spaces. And I think we need to challenge the notion of what safe spaces are. And this is something we've been very passionate about doing as Rosaria Memorial Trust. We've been documenting the Nanga concept, which is a safe space which we've always had in our culture. It's called many different things in other cultures. I think it's been referred to as the egumeni or the but we found innovating with culture to be very, very effective. I think it also means people can relate to the advocacy efforts that you're trying to give in, and you start on a, instead of bringing in foreign concepts, you start on a level where everyone can really relate to, especially the young women. I think one challenge which we've seen and one challenge which I've noted personally in our advocacy efforts is sometimes we empower young people to be advocates in the public space, but we don't necessarily equip them with the skills to be able to navigate their personal lives and to be able to advocate in their personal communities. I think this is something which I've also noted in my own experience as an activist, where I can stand up in a room full of people and say this is not right on a human rights level, but then as soon as you come into your own community, you're told, all your feminist ideals are for work and you need to leave them out the door. So I think that's one challenge which we've faced. Also, another challenge which has been brought by, especially with the COVID-19 pandemic, is something which the other speakers alluded to earlier, which is a lack of access. And lack of access for me means and exists on several different levels. So even looking at the conversation we're having today, where there are brilliant young activists, there are people who are working in the sector who are doing this work daily, but even being able to have the device to connect, to be able to engage with this conversation is a challenge. Even when they have the device, having the internet connectivity to be able to air their views is a challenge. When they have the device and they have the internet connectivity, infrastructure sometimes means there's no electricity for them to charge this device. So I think that's one challenge which we've been seeing. Then there's also lack of access in terms of SRH services on a very basic level. I think for adolescents especially, and adolescent young women, we've seen in the communities that we work with that there's still very much so, despite many efforts being done, there's still a stigma attached to young people and young women, especially accessing services. And we, oh, sorry, my.
Rai, are you there? Rai, are you there? Oh, I think we've lost her. Rai? So as we try to, as the Rai tries to connect back, I'll go, Dr. Haidara. I hope you're still with us. Dr.
Yes,
Haidara.
Yes, I am here.
Oh, thank you. So what are the two areas of focus on SRH and ending child marriage advocacy in Africa in the context of COVID-19? On the context of COVID-19, what, sorry, let me take that again. What are the two areas of focus of SRH and end child marriage in Africa in the context of COVID-19? And listen, what are your recommendations for integrating end child marriage and unwanted teen pregnancies in SRH frameworks?
Okay, because of time, I will go very short because Over said a lot of things. For me, the two areas to focus on SRHR and ending child marriage advocacy in Africa, there are two very critical things. The first thing is education, because we saw during this COVID time, most of schools are closed. And having girls get back to school will be very, very, very important for us, because we know most of the things are happen when girls are at home, when we are not going to school. The second thing, and very important, is around child protection and also gender-based violence, because we saw also during this time child protection is very, very critical. For me, these two elements are very, very important to focus on in the advocacy during this time. In terms of recommendation, you asked two recommendations. The first thing is, for me, we need just the government should promote the inclusion of comprehensive sexuality education as part of the learning packages for all schools. You know, we saw it during the closing of the schools, of the opening of the schools, learning online, learning in distance. We need just to make sure we have this inclusion of comprehensive sexuality education in all schools. This is one recommendation. My second recommendation, I think some of our colleagues talked about it, establish new ways of providing information and access, because the most important is access for adolescent girls and young people for sexual and reproductive health and rights services. We talk about it, you know, including through the use of social media, telehealth, pooling the, of multiple services, everything what Over said. I think these things are very, very, very important and especially in our humanitarian settings and during the crisis. This is of the time. Thank you very much.
Thank you so much, Dr. Ree. And then Tikala, Ms. Tikala, before you go, I know you mentioned you have another engagement in a few minutes. So can you kindly give us 2 recommendations on how to engage, how to integrate ending child marriage and unwanted pregnancies in the SRH framework? Ms. Tikala?
Thank you so much. I think 2 key things. The first one is the intersectionality and the holistic approach in addressing child marriage. I think especially right now with issues around the COVID pandemic, we know the biggest issue we're also going to see is high rise of poverty levels, and a lot of data and evidence has shown that poverty and issues of economic status has been a huge root issue around issues of child marriage. So I think the biggest thing is ensuring that we enhance and strengthen a holistic approach around addressing adolescent addressing issues around adolescent girls, child marriage is one, issues around sexual reproductive health. So I think that's the biggest recommendation in really looking at matters around economic empowerment of these households, because in a place of desperation, a lot of parents are always at a place, especially in these rural communities, are always at a place of using that as an excuse to put forward their child in issues around child marriage and so forth, or even girls not even going to school and so forth. So I think that's one of the biggest recommendation: economic empowerment and holistic approaches around child marriages. And 2, like it was mentioned before, and I want to emphasize on that as well, is that element of access around sexual reproductive health, whether it's within the household and parents are educated about this information and able to give this information to young people, but also parents being that caretaker to be able to connect their own children to connect to services that they need. But I think we also need to be looking at, because there's lockdown bringing services to adolescents, so having to really think through innovative ways to ensure access of information is still there during COVID, the pandemic, and also ensuring access to services is still there around sexual reproductive health among adolescents as well. So those are my 2 recommendations. And sorry, I know it's just 2, but one more. Let's ensure that going forward with programs and interventions that government and civil society organizations are working on, that they are including the youth leaders and the youth organizations that are on the ground working these to be part of a joint program and coordination to address these issues as well. Thanks.
Thank you so much, Tikala. Because you said youth leadership, is an interesting question in the Q&A section that I think you have seen it, about youth leadership and examples from Malawi. Like, are you about, like, in the next 30 seconds, just be able to answer that question?
Yes. So quickly to answer that question, so we have the Ministry of Health and Ministry of Education and UN agencies as part of our partners in the work that we do, who have been supporting us financially and with capacity with my youth-led organization. And I think the key takeaway is youth leaders, especially when you're in different spaces where you are engaging either with government or development partners, I think we need to be very strong in our ask in terms of saying, we are not leaving this space until we agree that as youth leaders in partner in the particular strategies, because we have seen that youth leaders are usually invited to give inputs to a strategy or a program, a commitment to make my organization or any other organization, youth-led organization in that room, an implementing partner, part of that strategy or part of that framework to be able to enforce the interventions that they, youth leaders themselves, are driving.
Thank you so much, Mr. Kala. I've seen Agnes has joined us. You're muted.
Hello, thank you so much.
So so this question is yours. What works for to ensure universal access to SRH in your country? Okay. and what aspect of SRH advocacy should be prioritized to contribute towards ending child marriage and teen pregnancies? Agnes? Agnes? Agnes, have we lost you? Agnes, have we lost you? Are you there? I think she can't get us.
Yes, I think she's having some connection problems.
Yes, she has some challenges.
Okay, thank you so much. Yes, hello?
Oh, I think she's now. You're muted, Agnes. You're muted.
Yes, I can hear you.
Go on and answer your question.
Okay, thank you so much. I was saying we are looking at the legal frameworks that we have in our country. We're seeing that they are very supportive to the issue of sexual reproductive health rights. For example, even our Constitution of Zimbabwe, the 2013 amendment, it's sensitive to the issues of sexual reproductive health rights. We have the Sexual Offences Act, the Marriage Bill Act, and also in every programming, we are seeing that we are using a multifaceted approach whereby participation of these adults, of these youth and adolescents is being of much cognizance. If you look at the United Nations Convention on the Rights and Welfare of Children, Article 12, it emphasizes the need for participation of children. So when youth are participating in issues that affected them, it means that we are somewhere already in trying to address the problems. In Zimbabwe, we have got the youth empowerment models. Also, we have the BEMGEM clubs, whereby adolescents, they meet together, they discuss issues that affected them in terms of sexuality. So that empowers them, that we have seen that it had empowered them, given them information, and assisted them in making informed decisions. Again, we have seen that there was capacity building of health workers who are in our local clinics and hospitals. And this has seen the establishment again of youth-friendly corners within our hospitals and also within our communities. These empowered and capacitated health workers are now able to offer services that are sensitive to the needs of these adolescents and young people. If we look at in Zimbabwe, we have the National Sexual Reproductive Health Strategy #2 that is covering 2016 to 2020. In that particular strategy, we see that that guides the way and operations partners who are into sexual reproductive health should go with. We are seeing that the monitoring of programming by those by the responsible authorities is making service delivery be of quality, and uptake is getting higher and higher every time. Again, let me look at the trainings that were given to traditional leaders and religious leaders. You know, these are the custodians of communities. So when religious leaders are targeted, they have large followings. So it gives the issue of access, it makes it so wide, making it has seen more and more youth and adolescents accessing information, accessing services, even if they're outside the clinic setups. Again, let me comment the issue of training of caregivers on issue of communication. Caregivers has been able to communicate with their children, breaking the social norms and taboos that are talking about sex, discussing about these issues with children, it's a taboo. But now we have seen that many caregivers are able to give information to their children, discuss about these issues, making them primary. Within the home, primarily, they get correct information, unlike information that they may get in the neighborhood from other people who do not have, which may not be well guided, and it may be used the wrong way. So dialogues, we have seen that they are getting better. Communication is getting better. Issues surrounding some misconceptions, some myths on sexual and reproductive health also, they've been demystified. Let me rush to the issue of advocacy. We have seen that issues of poverty, lack of information, the unmet need gap has perpetuated the abuse of adolescents and young people. So on issues of advocacy, we would advocate that there may be institutionalized embracement of sexual and reproductive rights issues within many organizations and institutions like churches, like schools. If it is embraced, it will allow for more people, adolescents and young people, to access it freely and without challenges. Again, let me recommend also and speak on the issue of social budgeting. If there is commitment by different institutions, organizations on their plans when they make budgets, that they be a small amount that is committed towards sexual and reproductive health rights, it makes sure that access is easier. Those who are to the ends in the peripheries who cannot access because of challenges in paying for services, if these people come in with issues of social budgeting, it makes sure that some people who are unable to access services can also access them with the assistance of organizations and institutions. Lastly, let me also speak on the issue of volunteer workers. We have got within the Ministry of Health, the village health workers within communities, and they are at village level. Those village health workers, most of them are above the age of 35. I think it may create a gap, and some youth may not be able to access services because of fear of discrimination and what sort. So if also youths, those 35 and below, could be part of those village health workers, it could also make a difference. It may increase uptake also. And making sure that material that is dispersed or that is cascaded to our communities is user-friendly
I think we're having challenges with Agnes' connection. So I have seen, as we try to connect Agnes back, Agnes? I'm sorry, Agnes. Agnes? Hello? So I'm sorry, we lost Agnes yet again. So I am going to go to the Q&A. There are quite a number of questions, but I'm going to ask to Salem. There's a question for you, but as you answer this question, I think you also touch on two recommendations of integrating the SRH framework in terms of ending child marriage and teen pregnancy. There's a question here directed to you. I'm hoping you have seen it. So there's this Nicole from Tanzania, and she's asking, what advice would you give to grassroots organizations that want to gain civil society, to work with civil society organizations standing with the UN in order to join this conversation at an international level? So as you answer that question, also give us two recommendations. Salem? Salem? Salamawit, are you there? I think she dropped of 2. So so I'm looking for, I think most of the other questions have been answered in the conversation. And there's so many sentiments about SRH and child marriage is a cultural issue. So it's a cultural issue. So as we finalize and as we come to a close to this conversation, I'm going to invite Lazarus. I'm so sure I saw Lazarus. Yes. I'm going to invite Lazarus to give us some closing remarks. And also, as you give us closing remarks, also give us 2 recommendations. Lazarus?
Thank you very much, Madam Moderator, and thank you so very much, our colleagues. It's been a very interesting and enlightening conversation this afternoon. Clearly, the dreams of young people can never be realized, and they cannot even reach their full potential if they do not have the power to decide when they should marry, when they should have children, and even whom they should marry. As such, the issue of sexual reproductive health rights, information, and services is crucial. I think now we've reached a stage in Africa where we can no longer afford and manage to bury our heads in the sand and think that young people are able to obtain and access this information from amongst themselves or even from schools. COVID-19 has actually taught us a big lesson as parents, as guardians, as the young people collectively, that let's have this information circulate even at family level. Let the parents play their role. Because with these restrictions in movement, schools closed, there is no place anymore where young people can access this information. And even service delivery for SRHR has been hampered by COVID. And the effect and the consequence of this is very clear for everyone to see. There are already reports of a spike in teenage pregnancy, a spike in child marriage cases. And that's a big question to ask collectively, traditional leaders, young people, government, civil society actors, to say, how can we address this big problem that is before us? Schools may open after COVID. Do we even know how many girls will return? And if we find many girls are missing, that will be too late for us. The time to act is now. And so it's actually incumbent upon all of us to ensure that within the national COVID response mechanism, the continental COVID response mechanism, and indeed at a global level, this response mechanism should have at the same time focus on SRHR information provision as well as services that are age responsive to all young people without any form of discrimination. And let me also just state that this issue is not only about girls and young women. It is an issue even for boys and young men. And quite often, we tend to leave those behind. And in a way, we create barriers by doing that. So we need to overcome the social barriers, the cultural barriers, the biases that we have within the healthcare providers who provide this information and the services. Let's, at a very much programmatic level, ensure that our interventions on ending child marriage are rooted within the SRHR framework. We at Plan International decided more than a year ago that our 18 plus ending child marriage and teenage pregnancy program will have a strong foundation of promoting SRHR services and information, as opposed to the past when we used to take the issue of child marriage as a protection issue, where we just want to protect girls and boys from marrying at a young age, but rather now realizing that these are human beings with the power, the capacity to think, the capacity to make decisions. And so even as we engage in our program, that is very, very crucial to realize. And in taking that up further, it's also important that our COVID-19 national response mechanism have a focus on creating space for young people to add their voice on this issue. And for us as civil society to create that support, to create that environment through which the young people can engage safely and to stand by them. Obviously, this is a big issue that we can only resolve through partnerships. All of us have different strengths. And it's crucial, like it has been stated in this conversation this afternoon, that let's coordinate these efforts. Not a single organization can afford to do this big emerging emergency outside COVID-19 that is already lingering ugly head before us. Let's have the young people exercise the leadership. They are most affected, especially girls. If they fall pregnant, the chances of many of those rural girls to get back to school and continue on their education path is very, very slim. And let's pay much attention and speak with one strong voice for governments, for cooperating partners that are bringing some of these resources on the table to address COVID-19, to have an eye on the issues of SRHR information service provision and also provision of the service as it is. So let me not say much. I think a lot has been done. Just to emphasize that let's work together. Let's speak with one strong voice, because the attention of government would just be to let's increase testing centers for COVID-19. What about finding a mechanism of increasing SRHR information provision as well as service availability? So that is key, and collectively, let's work on that. Let me pay special tribute to all our participants, our panelists, in no particular order. Thank you so very much for this information that you have brought to the table for us to share, reflect on, and take up. And let this information inform our programming, let it inform our advocacy messages, let it be a motivation to young people that they are not alone. Many thanks also to my colleagues who have organized and continue to organize this webinar, in particular the colleagues in our African Union Liaison Office. I can't avoid to mention the name of TAEG and the rest, our partners who are supporting this in Plan International German, and of course to you, Madam Moderator, for the great work that you continue to do. I wish everyone all the best, and please stay safe, and may you all have a